Okay. Hello, everyone. Welcome to the Teaching and Learning Thematic Working Group Skills Building session. This is a session that we are looking forward to engaging with everybody, building capacities around teaching and learning. Our topic for today is building capacities to address multi-sectoral challenges in health, transforming the roles and experiences of educators and policymakers in health policy and systems research. So this is a very, very timely session in terms of learners, educators, and policymakers, as well as implementers, in terms of supporting health system strengthening across the world. And we think that we need a lot to engage, and we need to build capacities to support the changing environment that we've seen, thanks to COVID. So I'll start with the introductions. So today we have wonderful speakers from across the world. Myself, Gina Teddy, I'll be your host as well for this session. And we also have Professor Lucy Gilson from the Health Policy Division School of Public Health and Family Medicine, University of Cape Town, South Africa. We also have with us Professor Anthony Zui, Global Health and Development, Faculty of Arts and Social Sciences, University of New South Wales, Sydney in Australia. We also have with us Dr. Dina Valabanova from the London School of Hygiene and Tropical Medicine, United Kingdom. We also have Dr. Zul Kanen Abdul Karim from the Center for Health Services Research, Institute for Health Systems Research, Malaysia. Then our last speaker would be Dr. Meike Schleff from the Johns Hopkins Bloomberg School of Public Health, United States. These are wonderful speakers. They are going to tell you about different topics that I'm going to take you through in a moment. But I hope you stay with us and engage and enjoy our skills building session. So to tell you a little bit about the thematic working group, we are basically a teaching and learning thematic working group supporting to build a field of HPSR. And when I say HPSR, I'm referring to health policy and systems research. Basically, we focus on ways to improve teaching and learning of health policy and systems research around the world. We have followers and we have members from all over the world and in all the regions, using the WHO regions. We emphasize particularly on applications of key competences and learning in low and middle income countries to support disadvantaged population, as well as engage between the North and the South. So there is a mutual learning across in terms of what we do. Our main objectives is to provide an interdisciplinary forum for teachers, students, educators, administrators, and anybody interested in teaching and learning, or even building capacity for HPSR. We are also interested in collaborating and sharing information about the scope of the field. We know that HPSR is a new field, but it's growing and is becoming very influential in the world in terms of health policy and systems, but basically in terms of health and the health sector overall. And so we realize that it's very important that collaboration is fostered, and through building skills and capacities, we've found it's important to share information. So we look at the scope of the field, education, approaches, curriculum development, pedagogical techniques or approaches, teaching and learning materials that are available. We share them on our platform. We also think about innovative teaching and learning and responding to the changing times so that we can be responsive as much as resilient to the needs of the health systems and the changing world that we find ourselves in. It is also looking at capacity building issues. So who are the executives of this teaching and learning thematic working group? You have myself, I'm the coordinator for the Center for Health Systems and Policy Research, and I'm also a lecturer at the Ghana Institute of Management and Public Administration, but I'm a co-chair for the and I've been a co-chair for the past 3 years, going on to 4 years actually. And together with Francisco, Dr. Francisco Oviedo Gomez, who is a programs coordinator with the Ministry of Health, Costa Rica, and also a lecturer at the School of Public Health, University of Costa Rica. We have a coordinator who just completed her PhD. Congratulations, Ayat. So this is Dr. Ayat Abu Agla. She is with the Center for Global Health, Trinity College, Dublin, the University of Dublin, Ireland, and she's also working in Geneva at the moment. The three of us are going to moderators for this skills building activity. So you'll be seeing us along the line. To make our work possible, we do have very able steering committee members who support us. They are people who are their expertise in teaching and learning, building curriculum, and basically the field of HPSR. So these are Professors Lucy Gilson, Dina Balabanova, who is also on one of our presenters, as much as Lucy. We have Dr. David Peters, Dr. Micah Schlepp, who is also on today. We have Professor Kabir Sheikh, and we have Michelle Castelli, Shiv Mata, and Gary Aslean. All of these are people who support us to make sure that we are on track. And then besides them, we also have regional representatives that support us in the various regions, Africa, Europe, North America, South America, and the Middle East, and anywhere else. So if you are interested in what we do and you want to join us, you can contact Ayat. This is our email address. You can go onto the HSG website, you can find the TWGs and subscribe. We also have our news group that you can always subscribe to it. We send you newsletters as well as any information that we think is useful. We have a lot of information on our website. Going onto HSG website, when you go onto our webpage, you find a lot of information there, and that will help you if you are starting in terms of teaching and learning in HPSR. So on that note, we want to know our participants today. Can I kindly engage you by asking you to send us your name and your institution and the country in which you are joining us from today? And then we would want to acknowledge you and really we are glad that you have been able to join us in our activities. So there is some polls that will be running, and these polls will help us to know who you are and what you bring on board, because we'll be engaging with you in terms of our chats and questions and so on. So please feel free, start the poll, join us. It's only 4 questions. Tell us what you do and how you find this, the activities and anything relating to teaching and learning that you think will be useful. And we'll look at that later on when I finish my next presentation. So if you have any question as well, please raise it and we would respond to it when I finish my next presentation. So I'm going to just tell you some of the skills building activities we've done between July and October, just before the Global Symposium. I'm just going to give you a summary of these presentations. These are very useful skills building activities. Some of them will be reiterated today as well, because they are very important, and others will add to it today. So we have had we've had 3 sessions. These are the 3 sessions that we've had. The first one was in July on the topic approaches to accelerating and enhancing teaching and learning in HPSR. And I'll look at the details of these. We also had one in September, which looks at supporting the next generation of HPSR, lessons learned across 3 teaching and learning case examples. Then we also had the last one in October, which looked at interactive teaching approaches for HPSR to address current and future consequences. Now, in terms of the first one, which is the approaches to accelerating and enhancing teaching and learning, HPSR, we had wonderful speakers, some of which are here today. In fact, 3 out of the 4 speakers are here today helping us on some of the sessions. So I'm not going to go into details, but the key things, the focus for this session was to look at the key competency framework, which was developed by the Teaching and Learning Thematic Working Group, supported mainly by various institutions. And I think this day I'm going to speak to this framework. And you can see there are 7 frameworks looking at how that support and build competencies when you are teaching, learning, or doing research in terms of HPSR. So they look at it broadly as the key competencies that people should think about in terms of HPSR practice. This is not just telling you that this is the core competence that you have to look at, but it is a tool. It's like a toolbox that you can look at in terms of when you are developing any teaching and learning in terms of HPSR. And these were things that were useful in terms of how people have applied it across different countries and contexts, particularly various institutional contexts. So here, this was presented by Gina, who looked at how this can help in building talent, and thinking about resources, aligning it to policies and processes, building relationship and nurturing people. And I'm not going to try and explain it because she's going to do a good job in her own presentation. But basically, it looks at how these competencies can inform planning, implementation, and monitoring and evaluation. We also had a typical example of how the competencies have been used in Malaysia, and the lessons of how that has been applied through a consultancy processes, were also applied through stakeholder engagement in key policy and implementation processes, for workshop and capacity building development processes, and even to inform projects, HPSR related projects. So yet again, Zor will be speaking to some of these issues in his presentation. So you'll get the opportunity to learn from it if you didn't join our webinar. Then we also saw how this was applied in the Philippines as well. Also referring to other taxonomies or any other frameworks, existing frameworks. In the Philippines, yet again, they use it to build networks and capacities and also community supports. So it tells you how adaptable this framework is and also how various learning can be done through it. The second webinar session was supporting the next generation of health policy and systems researchers. And here we looked at learning across different teaching and learning case examples, particularly. And we also saw 5 presenters, one of which is a moderator today. None of them are here, but I'll just speak to some of the key things that they looked at. So they looked at how they applied also some of their own HPSR knowledge and capacities in terms of the Perform to Scale project in different contexts, particularly in Ghana, Uganda, and Malawi. And here they looked at the experiences where during the COVID situation, this HPSR knowledge became very useful in managing crisis, in making changes and becoming adaptable and resilient, particularly when you are running a project or even when you're building capacity of your team. So this is also a very useful context, particularly looking at how district health managers and district management teams and implementers apply their knowledge from health systems and policy research. Some of the key skills and competencies that they use and think it is required for next generation HPSR professionals are what they summarize as look, listen, and link. Here they were looking at research, having strong research skills for people to be able to apply the methodologies that are appropriate to the various research projects that they are leading. And then also being able to listen. And here they are looking at listening and adaptation in terms of work interdisciplinarity, which is a key component of HPSR. And also the various multi-sectorial areas that we engage. Then also they looked at things around link, which is looking at communication, particularly effective communication, to inform decision-making, to be able to respond appropriately to what is needed. And here we also saw various examples from people who came on as students, as much as lead of the project, as much as people who were implementers of the project. So there were various experiences that were shared through this as well. The last webinar which we had was interactive teaching approaches. And I'm giving you the summary of these webinars because these are useful in terms of the discussion we are going to have after my presentation. And that is the skills building, the capacity building that we are hoping to achieve today. Is teaching approaches for HPSR to address current and future consequences. Here also we had 5 panelists who include myself and other speakers who are a combination of teachers, moderators, facilitators of HPSR programs in various universities, as much as students and policymakers and implementers with various knowledge and backgrounds. And for this particular webinar, what we saw coming through strongly was the fact that context of learning, content of our teaching materials, as much as the audience and their characteristics, particularly the previous knowledge that they bring on board, are very, very important in defining the rationale for learning as well as the learning outcome that we want to achieve and how we can adapt this. And there were key issues that came across as well in terms of interrelated competency dimensions. And here they looked at the individual competencies, team competencies, and system competencies, as much as the various leadership skills we are building for learners of HPSR, as much as the people we are building capacity for. And in terms of holistic model of competence for individual competencies, we are looking at it from developing cognitive competencies, social and functional competencies, and getting that in a meta competency framework, which is on the right. Some of the students stroke policymakers and implementers also shared their experiences, what they found very useful in undertaking HPSR courses, which is very useful and refreshing to hear because it tells you that we are doing something right, but we still think that there's always room for improvement. So the key thing that they saw was useful was having that system dynamics in terms of teaching, and also developing, breaking things down into small wins and sustaining, and also knowing the mindset of your stakeholders or health actors particularly, and focusing on people, because what they thought was useful was the realization that people was at the center and not policy and not necessarily processes. So they found that very useful in terms of the training that they had in the various experiences. And from these webinars, what I took away particularly as coordinator for some of these things is that there were key things, HPSR has a relevant and still play an important role in our environment because everybody related it to the COVID situation and how useful it is and how their skills or competency that they gain through their learning or through what they have done was very relevant in how they adapted to the situation that they were faced with. And then also what was crucial was the fact that despite the fact that all these webinars were looking at expertise and experiences from different backgrounds, key issues that keep coming up was the issue of competences. Whether it is a leader, a student, whoever it is going to take some position that requires certain competences. And HPSR was providing those competencies across board. And I think this is very important in what they impart and what they do in terms of what we are going to do today. So on that note, I think I'm going to stop here and allow some conversations around any question and answers, and also to look at the polls as to who is in the room and what their experience also of HPSR is, if they have any experience of as a teacher, as somebody who builds capacity, as a learner, or even somebody who is very important in health systems. So I'm going to pause here and see if there are any comments or questions with regards to this. Thank you very much. Okay, is there any questions that we have to respond to? Okay, so if there isn't any questions whilst we are waiting, I think I'm going to introduce the next speaker, which is Dr. Lucy Gilson. Sorry, Professor Lucy Gilson. Lucy, please forgive me. And Professor Anthony Zui. I think they will introduce themselves. So I'm going to hand over to you, Lucy.
Great, thank you very much. I see there were 176 people currently on this session, which is absolutely fantastic, and really delighted to be part of it. Anthony and I are going to work together in introducing some more ideas around interactive teaching and innovative assessment. As Gina said, I'm based in Cape Town, and I'm a passionate educator. I noticed from the polls, and I believe you can only choose one item, so sorry about that, but I noticed from the polls that we have folks who have experience in some interactive teaching methods, so that's great. But I hope that we can share our experience, both Anthony and I, and those of you on the chat, and we'll try to keep track of the ideas that you're raising. So in the forum discussion, please share your experience, raise questions so that we can come back to them. So Anthony, as the slide shows, is from the University of New South Wales, long-standing experience in education, particular work in humanitarian and development policy research and teaching. Next slide, please, Gina. So I just wanted to start with the results of the HSG capacity survey that was done last year. We included specific questions around teaching needs, and I saw on the polls being conducted that you agree we need to develop educator capacity. And this slide just clarifies that the sort of topmost needs, which is the blue bars, include a focus on interactive teaching, as well as blended teaching, which I think we're all getting more familiar with as we go along this year, and also developing assessments, which is another issue that we'll come back to in this session, and issues to do with program design that we'll also come back to. So through this session, we are trying to address some of the needs that were identified in that survey. Thanks, Gina. Next slide. And next slide. So what is interactive teaching? It's really the stuff of getting people involved in the classroom, in activities that enable learning. So it is the practice of becoming active, being interactive in the teaching environment. Next slide, please. And it is important as educators to think about interactive teaching because it enables real learning, deep learning, because it's motivating. It gets people wanting to learn. It gets people engaging with ideas and concepts and wanting to understand their meaning. And it develops the critical thinking, the problem solving skills that are so important to the students we engage with. I saw on the polls, most of us are involved in teaching postgraduate students, but undergraduate students also. These are adult learners. It is important that we as educators provide space for active learning by these adult learners, that we learn from them as well as we hope they learn from us. And it's part of, it can be brought into peer assessment, and Anthony will speak a little bit more to that. Next slide, please. So just a reminder of Bloom's taxonomy, the different types of adjectives we can use to establish our learning outcomes, because they reflect the real outcomes we are hoping to achieve through our educational activities. And right at the top is creating, evaluating, analyzing, applying. Those sorts of learning outcomes really can only be achieved through adopting interactive learning activities. So it's really important that in order to enable learners that we engage with, whom we engage with, we think more about how to do that. Next slide, please. I want to give you 3 sample teaching objectives from one of the courses that I'm involved in. It's a course on health systems. The first one is show understanding, and that's a sort of knowledge related objective, in this case of dynamic and complex systems. The second one is analyze the critical factors influencing how a health system strengthening intervention has impact within the system. So that's an analytic skill that we're trying to develop. That requires interactive teaching. And the third one is demonstrate the team working skills important in analyzing and strengthening health systems. You can't strengthen a health system as an individual. It is always going to be the case that we're going to have to work in teams. And so as part of our educational activities, we're also trying to provide opportunities to strengthen that team working skill. So those are three objectives from one of the courses I'm involved in that show Bloom's taxonomy, if you like. Next slide, please. So active learning is really about how we design our curricula and our teaching activities to allow opportunities for the learners to read, but write, but also analyze, discuss, and develop their thinking through the practice of applying ideas. Next slide, please. And there are a variety of approaches we can use in our teaching. And we did a poll, and some of you clearly have experience in these. It seemed to be that the 3 top interactive approaches that we're familiar with are small group work, brainstorming, and case studies. So let's just, I want to pause on this slide and talk a little bit about these different types of interactive teaching. So an overall approach to learning is the flipped classroom. To be honest, I haven't previously used a flipped classroom, but during COVID times, I think I'm becoming more familiar with what it means. And I will be seeking to apply it when, if it is possible, to go back to some face-to-face teaching. And it will mean that I will encourage my students to do to listen to lectures if they have lectures, to do the reading that we ask them to do in advance of coming to the classroom, so that in the classroom we can spend time discussing and talking together, discussing challenges of the material that's been introduced, but having opportunities to engage with each other as well. Then we can think about interactive teaching approaches as part of lecturing. You are aware or familiar of some of these. I'm just going to talk about think, pair, share. I mean, we know that people cannot absorb too much lecturing. So after 15 or 20 minutes, we should always break a bit. And one way of doing that is to throw a question to the class, people to think individually, then in pairs to discuss, and then share more widely. In small group work, you're familiar with it, but there are many different types of small group work. I want to talk here about jigsaw sharing, which I found really useful. So for example, we do an exercise where students are asked to read articles, and we break them into 3 groups, and each group reads a different article. When they come together, they first work with people who've read the same article. So they discuss that article and understand it together. Then they move into a second 3, where each person in the group has read a different article and they teach each other about the article they've read. And then they generate some overall learnings from across the papers that are fed back to the plenary. I find that a really useful way of engaging people with concepts. I'm not going to talk much about assessment because Anthony's going to pick that up, but just note the possibility of peer feedback as a form of interactive teaching. Next slide, please. It's also important that we think about how to use interactive teaching approaches to encourage critical thinking. Our students are going to be applying the ideas they take from the classroom in the real world, and application requires critical thinking. That journal club exercise is a way of encouraging critical thinking, in fact. And we can also do it through the assessments we apply, or we ask people to submit. And we can do it through actively talking to people about what argumentation means and encouraging concern for argumentation in the way they engage others and in the way they write in their written assignments. And we do that by introducing ideas about argumentation, and that includes the importance of being able to back up your claims with evidence when you make claims, whether it's a verbal discussion or a written discussion. And then we actively assess for that ability to argue in the assessment rubric. Next slide, please. And I want last just to talk about the importance of being part of a community as a student. And that's never been more important than during the COVID era, where students are meeting online. There are lots of resources out there. I encourage you to look at this website, which offers some, to think how to create an online community until we can get back into the classroom. And with this, I'm now going to hand over to Anthony. Thank you. Over to you, Ant.
Okay, thanks very much. And as with these time differences, good morning, good afternoon, and good evening. Over here, it's nearly midnight for me. I'm in Sydney, Australia, and I just want to do what we do in Australia, which is acknowledge the Indigenous owners of this land, the land on which we live and work, and to acknowledge also that this land was never ceded to those who settled and colonized it. So I'm not sure what's happened to the slides. So do we have them? Do we still have the slides?
Gina, can we show the slides again, please?
So if we carry on where we left off with Lucy, what I'd like to do is pick up from the point where Lucy left off and talk a little bit about innovative assessment, drawing on one particular course as a case study for us to discuss. And I think it does highlight many of the issues that Lucy has already spoken about in terms of adult learning, different approaches, and importantly, integrating the assessment and sharing of experience throughout the course rather than just at the end as an add-on. So I'm going to talk briefly about a course that we run with undergraduate students. They come from a variety of different degrees and programs, engineering, law, health and sciences. It's called Humanitarian Action, and it's a part of a development studies program with the view to trying to engage people with learning about what it's like to work in development and humanitarian settings. This particular course is a 10-week course. It's about 3 hours per week, and it is structured around an extended case study, which really places at the center the most severe typhoon to ever make landfall. Next slide, please. And that typhoon was known as Typhoon Yolanda or Typhoon Haiyan, which hit Tacloban, an area within the Philippines, in 2013. Can I have the next slide, please? Next, thank you. So the broad objectives of this course, and I think again it's important, as Lucy has mentioned, to set out, and Gina mentioned, to set out a plan to clarify what it is that one's trying to convey or learn about or share, the types of competencies at the end. So for this particular course, it is around becoming familiar with the current debates and concerns in the humanitarian field, to understand the system, who participates it, who are the actors and organizations, and how they operate, what are the processes through which they're involved, to appreciate the difficulties and challenges of actually delivering humanitarian assistance in complex environments, and to reflect on how knowledge and practice are advanced in these sorts of settings. And I'm sure every one of us could apply related types of objectives to different fields, whether it's health policy and systems research, or just talking about health systems or primary healthcare. You could adapt those types of objectives. By the end of the course, we expect that people can sort of synthesize ideas, utilize knowledge and strategies, and work successfully in a particular type of context, a volatile environment, to demonstrate some skills and competencies around problem solving, negotiation, working in teams, and achieving positive outcomes at the end, which are evaluated, and recognizing and articulating what are the ethical and values that underpin their work in a particular field, in this case, again, humanitarian action. Next slide, please. So we start really the course by immersing very quickly students within the particular environment and setting, the context. So really from right at the start, they perhaps feel overwhelmed with information about what happened on the day that this particular typhoon hit, where it was, what time it hit. They listen to podcasts, newscasts, look at the newspapers, and some of the reports about what happened, because on that day, tens of thousands of people lost their lives, about 4 million people were displaced. And as you can see, the whole environment was absolutely shattered. And we then ask them to select, or they select themselves into a number of different groups. Next slide, please. Through which they might be looking at how to respond to this particular environment. So what we do is we put them into a range of groups, which I'll describe in more detail in a moment. Community-based organizations in that setting, the local government, which is shattered at the time, the United Nations coordinating system from the sort of cluster response, and then a range of people involved in different sectoral responses, such as shelter or protection, health, or education. So the whole course is structured around being immersed in this particular setting, understanding what's going on the ground, and then grappling with responding to it. So that provides the spine, if you think about that, going all the way through, with a whole range of other issues coming off that spine. So some of the content areas, understanding the broader system, understanding different types of crises, understanding what has happened previously, and thinking about a whole range of things like gender and culture and who's got power in these situations and relationships. The class members become people on the ground working in those different groups that I described, and we work through a set of values and principles that underpin humanitarian action, thinking through those, talking about them, debating them, questioning whether they do actually apply always in practice, and what some of the dilemmas are that people might face.
Anthony,
They
2 minutes.
2 minutes, okay. So within that environment, we then set up a range of different assessment activities. So if you just look on the right side of that slide, I've listed a number of the assessments. They start off by that immersion, which I mentioned. They then work on their own as an individual, do a first task, which is within one of those groups, but they examine material and describe by themselves and submit this, the context, challenges and needs, and the interventions that are required in a given setting. They then spend time working together and exchanging their ideas and the feedback they've received. So this would be all the people perhaps in the health group, which apply a health lens, work on their own, get feedback, and then come together and exchange those ideas, and then go into a group mode where they work together to share what they've learned, what feedback they've got, and to develop a shared group response from the health sector. So they're doing research, they're engaging, they're building relationships and formulating arguments. And then they go into a third assessment, which is a simulated coordination meeting, which takes place some point after the acute emergency, when all the different sectors are presenting their ideas about how they can move from an emergency to much more of a development mode, how they can think about issues of equity and sustainability, transferring power, and longer term responses. Next slide, please. And that really happens in week 10, where they are presenting in that particular environment, and the students get very actively engaged. They take it very seriously. I've had colleagues who actually worked in the response to Typhoon Yolanda as part of the course members or as part of assessing the students. And they said it's exactly like what happens on the ground. So through the course, they gain understanding about the setting, the challenges, the difficulties. They really have to grapple with learning very quickly, assessing the evidence, sharing information, and developing better plans. They've got to think about moving beyond the acute stage to thinking, well, what gets left behind? What sorts of capabilities and capacities? How's this going to be sustained? How's it going to be funded? How do we evaluate what worked? So they end off with a final assessment, which is done after the course is concluded, which is really a self-assessment and reflection in which they need to think about a range of issues, such as reporting on what they did, relating it to other activities, thinking about their journey and approach to learning, and reconstructing what they would do better. And then they also have to demonstrate depth in what they've learned in one particular area of interest. So I hope that this gives you an idea of what we would call sort of layered or scaffolding assessments. Each builds upon one another. They go deeper and deeper and broader, and people certainly enjoy it tremendously, and we learn a great deal from it, and it's been a lot of fun, and I think a good way to assess students. So I'll throw that open to discussion and thinking about and other people's examples. Thank you.
Great, thanks, Ant. So Ayat, I think we have some questions, and there's also polls going on. So if you haven't polled, do poll. Ayat, over to you.
Yes, thank you. Thank you, Lucy. Thank you, Anthony, and to all of us, to all of those joining us. Good morning, good evening, and good afternoon. And we welcome you all to this exciting and interesting skills building session. So as Lucy mentioned earlier, we do indeed have a lot of participants with us, where 67% are researchers, 13% are educators, and 12% are learners. 4% have identified themselves as policymakers. And while jumping back and forth into the questions, the polls, and looking at them in answer to the question, if do you engage in any of the following, 45% of our participants are actually engaged in postgraduate training, and 6% in undergraduate training, while 31% in capacity building. So Lucy, while we're skimming through the polls, there was a question to you from one of the participants, and Shivan Savataji, and excuse me if I'm pronouncing it differently. The question was if you could please explain more about the fact people as the heartbeat of the health system. So who are they, and the stakeholders for health, or HRH? Over to you, Lucy.
Great, thank you. Really critical question. And we're all part of the people who are the health system, whether we are health professionals, whether we're researchers, whether we're managers, whether we're communities and citizens. The phrase means all of these people, as it is through us and with us that health is created. And so in terms of our teaching, we have to think how we can introduce that notion and develop people's understanding of that notion, and how to, what it means for when we analyze what a health system is and how it's functioning and how to strengthen it. Thanks, Ayat.
Thank you, Lucy. Anthony, another question to you. How do you handle a case of slow learning and lack of interest? And at what stage do you advise a student to change course in a professional college?
That's a good question. I think it's important to recognize that people do come into any program. We call a course, the program's the degree and the course is a unit within the degree. I think people use different sorts of language, but within the a particular program, I think it would be important to determine after a number of courses whether someone is really interested, engaged, applying themselves, and really to talk with them about whether they are really geared up for completing that degree and taking it forward. And often people are advised to either, really engage more deeply, or perhaps find another application. Within a course, I think one has to do that in sort of a short period of time. So we're talking about 10 weeks. Within our particular courses, really the idea is to encourage people to be involved, to assist. So we are facilitators. They're often working in groups, they're working in a class, they're expected to be self-motivated, but people often need assistance with finding out how best to learn, how to work in a group. And as facilitators, those are important issues to bring to the surface and to let people know that these are common problems. We all come from different educational cultures, different backgrounds. We learn in different ways, or we've had prior experiences which are different. And part of establishing the community that Lucy was talking about is recognizing those differences and making the classroom a safe place in which to discuss those issues, share amongst students what their different strategies are for learning, and as a facilitator to both engage with one-to-one and one-to-group sort of forms of activity. So I would say it's important to really support people, but if people are clearly not, not really engaged, not really wanting to do the course, then it's also important to find ways to sort of assist them to exit gracefully, in a sense, with dignity, and really find the things that they are interested in doing so that they can spend their money and their time more appropriately.
Thank you, Anthony. So the questions are coming in and we have to move to our next session. But before that, there was a couple of questions to Anthony. Also a follow-up is, what's your starting point for getting students to think in complex ways? And do you offer them frameworks?
Yeah, I think, sorry.
Yes, please go ahead.
Yeah, I mean, those are important issues. So I mentioned the sort of spine is the scenario, but coming off that are a range of frameworks and approaches and really contextual understanding and reading, cross-cutting issues, because I think those help one understand what's going on in complex environments. The second issue I would say is that one has to introduce the complexity with scaffolding, as I mentioned, so that you don't, I mean, on the one hand, sort of plunging people into something is important because it sort of wakes people up and you realize what you need to learn about, but then you need to go quite systematically in a way. And the assessments that I described and the sort of class activities were partly starting with just understanding the setting. So what is the context, being able to describe what's going on, who the actors are, what are the needs that were revealed. So it's very descriptive initially, and then working through things like, well, different people see in the same group would have seen different things, bring them together, get them to exchange those ideas and realize, well, we're not all seeing the same things. There are a range of issues. Now let's share those, but then, rank them. Which ones are most important? Which ones can we do something about? Which ones are important in the longer term? And then one introduces these other aspects of all the other actors and resource constraints. And certainly it becomes a complex system that one have worked through systematically and gained confidence from the base in which you're standing. And I think that has been surprising how people have grappled with that complexity by the end of 10 weeks. That's not to say they're going to be a practitioner in the field at that point, but they've got some understanding that goes well beyond just the surface understanding, and they're beginning to analyze problems within the system, as Lucy was talking about.
Thank you, Anthony, and thank you, Lucy. Because of time, we'll be starting the next session now, but definitely the questions that have been asked by the participants will be answered, hopefully via chat, so we'll be on time. Lucy, Anthony, any final words before we proceed to the next session?
I noticed that people say that they really like opportunities to observe or participate in interactive teaching in order to gather the skills and the confidence. And I wonder if as a community, whether we can do more to video ourselves as we try these things and share those videos. There are lots of online resources, as in documents you can download. So I encourage you to go and obtain them. Good luck with your interactive teaching. Go do it. Thank you.
Thank you, Lucy. Anthony?
Well, I think those are great comments, and it's been very useful to be part of this. I would say that one also needs to make clear to students what is expected of them and where one's going, and to help them reflect on what they're learning, so that one gains confidence through that. So I think that's a key issue. Right at the end, we actually say, what have you learned, and what have you learned about how you learn? Because one of the things that maybe they can take away from being involved in these different sorts of settings is learning something about their own abilities, for example, to work in a group, or whether they prefer working deeply on a very narrow subject or going across a broad range of issues. So appreciating their strengths and their weaknesses, and that feedback on their own learning or reflection on their own learning is very valuable in whatever other subsequent learning they do in a variety of courses and situations. So I think reflection, self-reflection, which is sort of supported and scaffolded is itself a very important part of these assessment processes.
Thank you, Anthony, and thank you, Lucy, and for all those joining us and all the questions on the chat. We will definitely, the panelists will be answering those questions throughout. And with the end of this session, I'd like to welcome our panelists for the next session, Accelerating National HPSR Training Capacity. And joining us as panelists for this session is Dr. Gina from the London School of Hygiene and Tropical Medicine. And also with us will be Dr. Zulkarnain Abdul Karim from the Institute for Health Systems Research and National Institute of Health in Malaysia. Over to you, Gina.
Thank you very much, everybody. It's wonderful to be here, and it's amazing to have so many of you joining, despite the difficulties and being on Zoom. So I want to take a few minutes to take you a little bit upstream. We are not going to talk about what's happening in the classroom. We're going to talk about how do we accelerate all this. We all agree we need to do a lot more, but how do we fill this gap? And I would like to talk about the experience that me and Zulkarnain are having at the moment with our teams working around that. So two main themes in my talk really about the coherence and the scaling up. So what is the problem? As I already said, we all agree we need robust evidence in real time. And it seems like when we did several times mapping at Health Systems Global, the capacity creation lags behind what we actually need. And it's not enough. We do courses, we help or institutions create courses or do new programs. It's really not enough. There are whole regions where things are increasing. In a way, the policy makers need this information now. They need this cadre. So we have huge gaps. And one of the regions I'm going to be mentioning today is the Western Pacific region, where we've been working on, and really very little in terms of organized institutional capacity. As well, we see incredible richness across the different institutions, different programs, but what we don't have is some sort of agreed definitions of what do we mean by HPSR. We have a lot of variability, and that's actually a good thing. We are not saying this should not be the case, on the contrary, but we need something which would help places where they don't have this capacity to make a start. So first of all, I think in our creation of capacity in research capacity, training has been a blind spot, and we all know it's extremely resource intensive. So next slide, please. Yes, so first of all, I want to cover two questions. What do we want to increase? What should the training focus on? I think as we saw in several mappings which were conducted within this thematic working group with HSG Global, to actually, there is a lot of variability and lack of consensus around what is HPSR training. Some people just teach management and they call it HPSR. In other places, it's overlapping. So we really don't know. So we had a process in 2017 to now with the group, and a lot of activities and other people, key informant interview, talking to people, educationalists and leaders in the field to really try to understand and develop consensus around what is the competency framework. Competency is the ability to apply a set of related knowledge, skills, and abilities needed to successfully perform functions and tasks. So we need to have a little bit more clarity on that. What this process was about was not to create a set which is taken and implemented exactly in the same way, but almost to act as a starting point, something that could be adapted in each different context. Next slide, please. So after the different methods, we ended up with this, which is just now launched by the group, and we're trying to disseminate and get feedback from people. And that's what we've been using in Malaysia. Zul is going to say a bit more. So these are the main areas I'll just briefly go over. So what is it? Understanding the health system, understanding the complexity, how different, not just building blocks, but how they interact, how do they interact. Try at the same time, skills and knowledge to assess health system related programs and policies, to implement robust research methods. The third one is to think across methods and types of evidence. And if you're a policymaker, to really critically appraise the research that's there that explains the health system performance. Of course, ethical reasoning came as one of the key points as we need to teach. That's a huge part of it. The leadership and mentoring, the fact that a lot of the HPSR researchers ask their questions which are rooted in policy, they're very much involved in this process. So therefore, there is a responsibility on the researcher of what questions they're asking. So we need to think about how we train in this. Building partnerships, networks, and collaborative models, and translating into practice communication. So these are the main competency areas. We had a lot of debate around those. Not everybody felt the researchers should be able to lead. So we would love to hear your responses in the poll. Next slide, please. Should we just focus on ability to implement, but also lead? So the next point I would like to make very briefly is how. Okay, once we agree, these are the competencies and they'll be slightly adapted in each setting. How would we do it? How do we accelerate? What doesn't work is working institution by institution. So we've been looking at the pedagogical approaches in educational literature. So we found very interesting perspectives which are beyond health. So we suggest, I would like to put it to you, that actually assessing training programs and the success of a training shouldn't be just about itself, the program and its learning objectives and outcomes, but it should be, does it have impact, longer term impact on the health system? Does it affect stakeholder attitudes? Is it embedded in the health system? Does it reflect health system priorities currently? Does it demonstrate ability to elicit complex mechanism in health systems? So it's much beyond. So it's what does this program contribute to health system strengthening, not just evaluating it in isolation. Next slide, please. Having said that, this is what I would like you to remember and to comment in a minute. So we argue that we shouldn't think of the training just at the level of individuals and organizations. We should really think of all the levels. We should think of individuals, organizations, and super-organizational level. What does this mean? This means thinking about relationships, resources, assets, nurturing talent across all these levels. So if you take a minute to think about it, we don't want to be training researchers who cannot be after that employed in the health system as a researcher. We need to think about longer-term career strategies, accreditation, something that would incentivize good, effective training. But without working at the national level immediately from the start, we can't do that. Next slide. I just want to give you maybe a few examples very briefly. This is just, I'm not going to go through this, and you have it in some of the links, the earlier webinars we have done. But just an example, you need, for example, if somebody wants to get trained as a health system researcher, so they need the expertise, the knowledge, but within their organization, there need to be incentives and resources enabling them to engage in this training. And then at the supranational level or super organizational level, there needs to be recognition of trainers, for example, accreditation. Without having this, we are really not going to achieve our objectives. Next slide, please. So this is, I would like to ask you to really look at the polls, and we're asking you basically to look at some of these competencies and to say which three are the most important, what's most difficult to teach. So I just want to finish and tell you that we think in our experience, and Zoe is going to talk more, but it is really important to think about coherence. When you create a new HPSR training program at your institution, you have to think about how do you act at institutional and national level and coordinate this action in order to be able to ensure sustainability. And then I would like to leave you also with this, redefining the idea of learning. Why do we think about courses and teaching and training? I think the learning should be, you do a course and then you go home, and in the weekend, maybe you read an article and have a peer group or mentoring sort of network where you could go and discuss with them. I think that's what learning in practice is. We should stop thinking a little bit about organizational formats. So really thinking about creating learning networks and platforms. And from the comments here, I can see everybody's really trying to connect to each other. So with this, I would like to hand over to Zul to say a little bit more about the Malaysia process. Thank you very much.
So thank you, Dina. I will continue with sharing some example how Malaysia have used the competency. So I will start by, sorry, please back the slide. Okay. I will start by giving some background of how we start the work and subsequently explain how we use the competency set in our HPSR training program, as well as how we expand the training program at national level. Next, please. So I will start with introducing HPSR. The Institute for Health System Research is one of the institute under the Ministry of Health when we focus on health policy and system research. We also is the WHO Collaborating Center for Health System Research since 1988. So we have conducting health system research training since then. And so our work on using the competency framework began in 2017, where we invite London School of Hygiene and Tropical Medicine to review our existing HPSR training modules. And later on, we plan to develop a new module on HPSR. So in developing this, we integrate the HPSR competency framework. Next. So we can see how we use the competency framework in our training program. Basically, we align all our outcomes of the training program, for example, the program learning outcomes, course learning outcome, as well as the learning objective during the course, then align it with the competency set. And we also use the Bloom's taxonomy in order to make exercise and example of how we train and align it with the competency set. Next. Next, please. For example, where we conduct a 3-day HPSR workshop last year. So one of the course learning outcomes is to have the participant the knowledge to plan activities to support the use of research evidence in decision making by engaging with policymaker and practitioner. So in this workshop, we have activities with the participant whereby we want them to be able to identify different dissemination channels and how these different channels fulfill the need of different stakeholders. And this we align with the competency set under the communicate, translate knowledge, and apply evidence. Next. So, sorry, can you switch back, please? So, with how we align the competency with our training activities, therefore, we also plan how we can expand the training at national level. So we look at this, we try to use our position as an entity in the Ministry of Health in developing a strategic plan for HPSR capacity building. So we do that by having engagement with multiple stakeholders as well as community to see their needs and their input in the development of the strategic plan. So we also, we call it this as a structural approach where we as a government entity try to use our position and try to expand the training from the central program until at the state level. So we also try to ensure that this this training align with the national health policy, and we also try to optimize our networking with partners. Okay, next. So our work in progress still at development level, and activities such as document review, engagement with different stakeholders such as the planning division in the Ministry of Health, as well as the experts in HPSR. And we also do engagement with health system activists, NGO, and this input will be going to the workshop that we are going to conduct later on. Next. Next, please. Okay. So having all these activities, what we learned from our works since 2017 is that we can see that competency framework that is being introduced help us to outline the outcomes and objective of our training program. And also in conducting the training, we find out that certain competencies such as leadership need more creativity for us to train the participant. And to develop a national plan, we need to get mandate and buy-in from the top policymakers. And the framework like what we introduced by Dina just now really help to guide the implementation for national level. And we need also to identify focal points to accelerate development. And it's also important to promote the value of HPSR for health system strengthening to participants. And lastly, with this COVID-19, I think we need to look at the positive side and garner more opportunities. And I feel education will not be the same again. I hope a good thing will come out. So to conclude, I would like to thank all my teams in the NIH and also the project consortium and funders from NIH UK. So that's all from me. Thank you.
Thank you very much to both of you, Dina and Sul. It's been a wonderful presentation, and we would like to start the Q&A section. And I just want to comment a particular word that came since the beginning of the presentation. It's acceleration. It's definitely caught my attention that nowadays that when the need, the urgency about developing the field of HPSR comes more clearly in a situation like we are having now with the global pandemic, coping with all this need to actually create more training and more capacity. It's an urgency, as I said, more clearly than ever. We have a couple of questions going on. Before that, I would like just to call the attention about the result of the poll. And quite interesting that in regard of the competencies that are more critical for improving health systems, we have results that most of our participants consider that understanding how health systems work, their complexity and policy process is the most voted option, followed by communicate, translate knowledge, and apply health system evidence. And definitely that actually I think relates to with the situation we are having right now. We have two questions that I would like to share with you so we can have some answers. We have a question from Tolib from the UK. He's saying that these 7 competencies are excellent. Are there any further ones which HPSR educators themselves can use in their own development? I think it's a very interesting question because the competencies are set or were meant to be drawn from the perspective of the learner, but what about the teachers? Is there any other competencies that the teacher must have? A teacher on the field of HPSR. So, Dina, Zul, what are your thoughts?
This is, in a way, interesting question. And there was a similar question, maybe several questions overlapping. I just want to clarify something. What we're trying to say here is that I see the boundary between learner and teacher not to be so strict, because I'm a learner, I learn. So when we teach and I do my course, I spend a lot of time after that reading on some of the cases that people have raised. We constantly learn. So I think these competencies that you see, Tulip, they're very much for us as well. So there is no end point of I learned everything. There is no such thing. I think that's what we need to understand, that, and that's why as teachers or whatever, teaching health policy system research, we learn continuously. I think that's really important. I just wanted to pick up on the Helen's point. There've been other regions where there's been a creation of regional networks. I think, such as CHPSA, I think that has been incredibly well known and successful, but that's what we're trying to do in the Western Pacific region. But you need to know that CHPSA started already with institutions that were quite prominent in this field. So they augmented, they got together, but in some regions we're starting from much more fragmented situation, and we have wonderful people, individual courses, but so what we're trying to do is to create something similar, because I think this is the future. If you do HPSR reading, you take the competencies and also develop, we would like to develop a regional, the repository of case studies that are relevant for the region, not just for policymakers, but for communities, for actual people on the ground. I think I can hand over to Zul. Maybe he can say more about this.
So I think comment from Tolip, I think one of the challenge as how in training HPSR is how to sell these ideas of communicating it to the stakeholder, to the policymakers, and we know this process is quite complex. And so one of the competency that can educators should have maybe on how to address this complexity, as well as how to understand the complexity in communicating this HPSR to the communicating evidence to the policymakers. Yeah.
And definitely the complexity is one of the key issues. I completely agree with you and our participants. As Lucy said before in her presentation, it's really hard to understand that health system is not only the hospital facility or the healthcare center, but we all are part of the health system from any individual perspective, as educators, as people, and that complexity is quite hard actually to translate and the classroom, because most of the people who actually come to our classroom have maybe a narrow perspective of our health system and just focus on this part of the healthcare provision. And breaking that, expanding that complexity, it's definitely a key issue, not only for the learner, but also for the teacher, how we transmit that. And definitely I stress once again that the key word in this presentation, acceleration, because it's definitely a must that we must understand that the pace that everything is advancing right now, and the demand of knowledge and the demand of actually have clear answer to very complex questions, it's there, and we have to keep going, and we have to make that pace. We have 1 minute to the next presentation, so a final thought from both of you, Dina and Zul, on this presentation. We maybe could expand later at the end of the session, but yeah, just one final comment.
Comment from me, I just looked at the poll, and a lot of you think that conveying complexity, training about complexity, and really sort of discussing what does that mean in practice. I think it's quite complex, and I agree with you. You rank this the most, one of the highest, as well as working in collaboration, communication. Many of you talked about it, and we often do it as something separate from our course, but it is actually essential, because the way you communicate results, the way you frame the results is really reflecting nuance, adding nuance to what you're doing. So your research, it's important to have the knowledge and the skills to communicate in different ways. And I think that's one of the challenges. So thank you very much. Maybe we'll have a few more comments, but I'll have over to Zul for final comments.
As for me, I think accelerate the development, I think we need to, for example, HPSR can use our position to influence top policymakers as well, to garner our position in the government to accelerate this. Yeah.
Thank you very much.
Thank you.
And we'll continue to be responding to the chat and later on if there is time.
Yes, it's part of the complexity we are facing right now. Right. So there are a couple of more questions and comments, but we will address them at the end of the session just to keep going with the rest of the channel session. And thank you both to Tawfiq, Annika, and other people who have made comments and questions. We will try to go back to you at the end of the session with more time. And having said that, we have the next slide, please, to present our next panelist. Yeah, so we're going to move to this theme presented by Dr. Michael Schleif about educational research to support HPSR capacity strengthening. Michael is our former coordinator of the TWG, so it's a pleasure to have her back here. She's working with Johns Hopkins School of Public Health as a citizen scientist. So, Maike, the floor is yours, and welcome.
Thank you, Francisco. Greetings to everyone, and thanks to the thematic working group for organizing this session and also for carrying forward and continuing to evolve so much of the work that the TWG has done since it was founded. So it's fantastic to be here, and I have the pleasure to sort of bring back onto my own radar, as well as hopefully for many others in the thematic working group, an ongoing theme that we've had for the TWG and have had a number of conversations over the years around educational research and how do we actually consider the teaching and learning that we do within HPSR as part of the research. And so I want to spend a few minutes in this presentation framing a little bit about some of the background work that the TWG has done, and also then talk about some of the approaches for doing educational research, of which many of them are very familiar to everyone, and then show a few examples of educational research related to the thematic working group and some of the work that members at the thematic working group have been doing for other related projects as well. And so I want to start by talking just briefly about what educational research is. I saw in the first poll related to this session that many of the respondents, at least to the poll, don't have any experience doing educational research so far. So just wanted to briefly touch on this. So basically, it just refers to systematic collection and analysis of data related to the field of education. So the same kinds of research questions and study design and methods that we use commonly in HPSR are also used within classrooms, and to both understand the goals of educational research could be anything from, as we've been doing with the thematic working group, trying to understand what should we be teaching, looking at pedagogy, trying to understand what kinds of teaching approaches are actually helping our target learners learn the most effectively, and then also really looking at the impact of educational research, of teaching and learning HPSR on health systems, on organizations, on the careers of the students that we teach. And so this work uses a wide range of methods, really as wide as the methods that we use for HPSR, and can look at a number of different facets, and is also used across many fields outside of education. So certainly the field of education itself does research to continue to sort of move forward on theory and application of teaching for a wide range of students, everything from elementary school all the way to the postgraduate students that many of us are teaching, and then also many specific fields, including certainly the health sector, but many other fields as well. Also really hone in on, are we doing the best job that we can providing education within our fields as well. So there's sort of a convergence of theory and approaches some of what we've seen in this presentation with Bloom's taxonomy and everything that's coming out of the field of education, and then also adaptation to different specific sectors that are trying to improve the effectiveness of teaching and learning. So this discussion around educational research for HPSR has been something that's come up over the years several times for the thematic working group. When we started the work of the TWG after the symposium in 2014, our first activity actually was to do sort of a scoping review mapping of what's being offered in terms of teaching opportunities for HPSR around the world. So we developed a survey and did a series of interviews and mapped the courses and other training opportunities, published that, presented it at one of the previous symposia, and then recognizing some of the gaps from that mapping study, both in terms of what kinds of courses were available, but also sort of the recognition, as Dina also mentioned, that there's still sort of ambiguity and different approaches to thinking about what should be within a strong HPSR teaching package, and being able to sort of organize and then adapt curricula around that for different contexts. We developed a competency framework, which we're in the process of publishing now. So that's also related to educational research within the TWG, but we've also had much broader conversations at previous symposia, and we had a smaller team within the thematic working group that really had some focused discussions around what do we need to do going forward, what's the importance of educational research, what are some of the challenges that we're facing, whether it's funding or where to publish this work, and then also kind of what are some of the priority topic areas where we could contribute to the evidence base that would help this group and also the broader HPSR community that's thinking about how to teach more effectively, different approaches, specific challenges during the COVID era now, and also how we think about and measure the impact of the teaching and learning that's happening within HPSR. Next slide, please. Thank you. So just to speak for a moment about approaches. So also just to go back and say that these are the same kinds of methods that we use for all of the other research that we do. They can be quantitative, qualitative, or mixed methods. Common approaches that are used include many of the things that we do for HPSR already, but just really thinking about our classroom and the curricula that we develop, how they're used as part of the potential research questions that we can build into our research portfolios. And that educational research can be more sort of exploration or theory generating or validating or sort of evolving. And it can also be very applied. Some of the work that Dina and Zul have been doing in Malaysia is really already taking this competency framework that's continuing to be sort of revised and given feedback on and use it in the Malaysian context. And so definitely both of those are incredibly important. And I think we have a bunch of opportunities related to the thematic working group and Health Systems Global to contribute to the evidence base on both fronts. So some of the challenges that I've been aware of and that I think the TWG has started to discuss, and that hopefully we'll have a few minutes on this call to discuss and hopefully find some ways to continue to move this forward after the symposium as well, is that oftentimes educational research is considered a soft science. Not that I know we have a number of discussions related to the competency framework as well about how important some of those soft skills or essential skills are for effective HPSR, and that building the evidence base around educational processes around the relationship building, as Lucy was saying, sort of building that community, doesn't always generate sort of the same kinds of quantitative or very clear evidence that we have relied on over the past decades, but really being able to delve into some of those challenging, complex questions, and also recognizing that educational research usually takes place within real classrooms, within sort of actively evolving health systems, and includes a range of stakeholders, not only our students, but often their supervisors, the people who are in charge of either educational institutions or health systems. And so it needs to be able to capture the context interactions between all of those stakeholders, and then the complexity of the content of the health system. And so I think some of the challenges with thinking about how do we establish sort of quality standards for educational research, how do we think about who needs to be involved, how do we conceptualize strong questions, how do we find funding for this work, and then where are the best avenues for publication, are some of the kinds of challenges that we've discussed some before, and hopefully we'll have some more time to discuss and be able to continue to support each other as part of this group going forward. Next slide, please. So I just wanted to stop here, and hopefully all of these links can be made readily available. These are a couple of examples of education-related research that, first, a couple of things from the TWG is our original mapping study and the forthcoming competency framework. Also, CHPSA has done some fantastic work and has a number of resources. They've created this assessment tool and results around assessing capacity of African universities. And then another project that several TWG members, including Sarah Bennett and I, have been working on the STAR project, which is a fellowship program for USAID based here in the US, but with participants from around the world. And we've done a number of education research activities, a scoping review around how to actually implement competency-based curricula within global health. And then also we developed a competency framework specifically for this program, and several sort of pedagogical strategies that we're in the process of evaluating now for that program. So these are a couple of examples of things that are happening already related to this group. Certainly there's also the work that Dina and Zul are doing, and I imagine a bunch of other examples from other members of the TWG as well. So I think that as a sort of closing comment, and then I would really be excited to hear from you all about questions you have, and particularly challenges that you're facing, and to be able to discuss how the thematic working group can help to create more space and make it easier for all of us to think about the actual teaching and learning that we're doing as part of potential research questions, and being able to continue to build the evidence base about really what is working in HPSR teaching and learning, and what are some of the additional resources that we as a teaching and learning community need in order to be more effective in the work that we're doing. And so I would say that I think one of the biggest challenges has been having a foundation. So this competency framework is one piece of it, and then I think CHPSA has done a fantastic job of putting together course materials, case studies, things like that. And so having sort of a go-to set of resources that we can then use and evaluate and be able to provide feedback on is an essential piece that we're continuing to expand and grow, and feedback on that front would be fantastic. And then the second piece is really, if we do educational research, whether it's on a small scale for our institution, for a particular health system, or something much more sort of broad or in-depth, what are the outlets for that work? And I think that's something that I've certainly struggled with. But I think we're getting to be able to a point where both a number of journals are really recognizing the value of this work. And I've spent quite a bit of time trying to find different outlets. So for anyone who has questions, and I'm sure that Lucy and Dina and many others in this group as well also have experience finding appropriate outlets, and that includes peer-reviewed journals, but also other blogs and websites and databases and things like that, where we can share the experience that we have so that it really contributes to and is available to others that want to build on it. So thank you for listening, and really excited to hear from you all about how we can continue to move this piece of work forward in the thematic working group during this discussion and after the symposium as well.
Thank you, Micah. It's always lovely to see you and hear your voice, and thank you for the interesting and presentation. And just looking at the results of the polls from our participants for this session, and in response to the question if any educational research they've been part of on how it has been used, 70% said yes for quality improvement for their courses and institutions, where we see a 19% saying that it's for the theoretical purposes or own curiosity. And also in response to the other poll question asked on how effectively do you think educational research has been so far in supporting teaching and learning in HPSR, 45% said that somewhat effectively, increasing now to 48%, and 43% are neutral about that, which is quite interesting. However, if we go to the another question on the poll, and your reflections, that would be interesting, Micah. The question on what is the biggest barrier to integrating more educational research into our HPSR teaching and learning, and 57% said that it's experience or applicable examples, 16% said funding, and 31% said time. So what do you have to say to that, Mickey? Over to you, Micah.
Great, thank you, Ayat. Really, really nice to see you as well. And I'm sure that other panelists probably have some thoughts on this as well. I think that the point about experiences and applicable examples, hopefully through this presentation, through this whole session with the example of what Dina and Zul are doing, and some of the work of CHPSA, and hopefully we're starting to sort of chart the way for some of the diversity of how educational research can look, and also sort of the trajectory, for example, with what Dina and Zul are doing, sort of the development of an initial competency framework, and then being able to sort of follow that through application in a particular context, and hopefully going forward being able to also look at sort of the impact that training is having and how it continues to evolve over time. Hopefully some of those kinds of examples will make it a little bit more concrete about what this work can look like, and the value that it can have. And it makes me wonder if we as the thematic working group can perhaps sort of find a place on the website or somewhere where we can highlight some of these examples and show how some of the different kinds of educational research can actually fit together and follow the trajectory of sort of the learning that we're doing as a thematic working group, and sort of illustrate some of what is possible. I think that would be incredibly exciting, and really happy and excited to hear ideas and examples of other things that already exist, and what would be most helpful to the participants as well.
Thank you, Michael. Before we go on to the final part of our discussion and session for the day, are there any messages that you'd like to say as ending notes? Over.
Sure. Yes, I think that the main point that I hope everyone takes away is that doing educational research, whether it's for HPSR or anything else, doesn't require new methods. It doesn't require sort of new knowledge. I think really the shift for me at least has been just starting to think about the teaching and learning that I'm doing as an opportunity to be part of sort of the research that I have going on. And so thinking about sort of the challenges that I'm facing with teaching as potential research questions, and just starting to sort of integrate that into conversations that I have with colleagues, conversations with leaders at the institutions that I work with and collaborate with, and just sort of integrating with the other kinds of studies that we do, and hopefully that can also bring a whole bunch of, I think, really creative ideas from this group as well for the kinds of questions that would be helpful to answer for us as a community, and that we can find a way as a TWG to help that move forward.
Thank you. Thank you, Mike. Thank you for that. And it has indeed been an interesting discussion and session, looking at the chat and the answers in the polls and so forth. And without further ado, then we'd like to go to the final part of our session for the day. Thank you, Mike, and I'll hand off to Gina. Over.
Thank you, Ayat. So I think we have had a lot of discussions. So we are just going to have a quick round of panel discussion looking at some key questions. What is the future of HPSR for teaching and learning, and for the field building, and for health system strengthening overall? And I think this is a panel discussion, so I'm going to give all the speakers and the moderators an opportunity to respond to this. And then if there is any, we have time, then we'll respond to other comments that others have that they want to respond to. So should I start with Lucy? Do you want to share your reflection on this question?
Great, thanks, Gina, and thanks to everybody for really rich presentations and fantastic discussion on the Webby platformy thingy. It's been really interesting to see the stuff coming through there. So what's the future of HPSR teaching and learning for field building and health system strengthening overall? I mean, in a word, I think it is collaboration. I strongly feel that collaboration is central to the way health systems function and the way we need to work together to support the strengthening of their function. And by collaboration, I specifically, with respect to teaching and learning, mean collaboration between educators and students, between those traditionally classified as researchers and those traditionally classified as managers, both of whom are also themselves managers and researchers. I think that the divides that we establish between the different groups in the field act to prevent the strengthening of education and the type of education that will strengthen health systems. And I think it is important that we find new ways of engaging students outside of classrooms, in workplaces, in their own workplaces, or in workplace apprenticeships or workplace placements, so that learning is part of health system functioning and not something that is outside of the health system, because it is through that we have real interactive learning and the possibility of moving as we learn. I think in classrooms we can construct such spaces, and it is important to do that, but I think we do need to collaborate between the different components that represent a health system. Thanks, Gina.
Thank you. Anthony, do you want to speak to it?
Was the question primarily what's the future of these this kind of learning? I mean, I agree with Lucy very much that bringing issues to the table, that we learn around issues that we are facing on a daily basis. So making things current, making things engaging, making things real, and validating people's experience, I think, is absolutely crucial. I think one of the challenges we're really facing at the moment, and would still be very interesting to hear people's views, but we don't have that much time, is about moving to online environments. And how do you do that effectively in situations where there are problems with bandwidth? There's clearly a digital divide. Some people have got much better access than others. Some people have got more space to work in and reflect on. Some people have the technologies to maybe, contribute videos and case studies, because all those things, those sort of many insights into what happens in the field and on the ground, are incredibly important. I'd love to, for example, establish, a website where people might be raising dilemmas that they're facing in different segments of their work, maybe in setting priorities or in engaging remote groups or in overcoming the discrimination that subgroups face, and different people can share their ideas about how they've addressed that dilemma in real time situations, but share that on a platform where we can learn from it, distill something from that, and share some of the strategies and sort of innovative practice that maybe we should be building on and developing techniques around, or developing good practice, guidelines, or ways of supporting disempowered groups. So I think those are the sorts of things that we should be thinking about, but they require a lot of innovation and access to technology, or thinking about how to do that in low-tech settings.
Okay, thank you very much. Zoe, your response.
Yeah, I agree with what Lucy mentioned. That collaboration is a must for this field, HPSR teaching and learning, because HPSR, by HPSR definition, that it encompasses almost everything under the sun. So we the networking can be can widen the collaboration, because we can collaborate with those in health economics, for example, health informatics, as well as the other areas that this still involve HPSR.
Okay, thank you very much. Gina.
Thank you very much. I agree with what everybody said. I would like to add two things. Bridging two big divides. What are they? The first one is really bridging the divide between institution, formal learning environment, and informal. I would like to see informal learning networks, not just per region, but groups of people who can support each other and have this peer collaboration, the same way as young people now are following influencers or connect to each other on platforms. I think it's great if we have something like that. And if I have a problem in my teaching, I can post somewhere, go to people. I think we need to be more agile. The same way as we now integrate content about COVID, we need to be like this constantly. There is no set content for HPSR. We respond to a changing environment. I wonder whether we're flexible enough. The second divide, final, is between teaching and practice and training, really convincing policymakers that, and people who run organizations, that you need to integrate teaching and learning in the practice. It's not okay to just have somebody going to a course. That's really not, but maybe they should have several hours a week or a month to reflect, to read something new, to connect to other people. That's not just cosmetic, it's really important for health system strengthening. Thank you.
Thank you for that response, Gina. Maike, can I have your response? And nice to see you again.
Thank you very much. You too. Yes, I would just emphasize, I think great points have been raised, and just I would really like to see us continue to break down barriers. And I think the online work that we're doing now, even this session, is a great example of working on that. But I think it's, being able to have things online so people can join wherever they are, working towards having key resources be open access, working on language barriers, and then really making sure that we as sort of conveners and, faculty members, are getting the right feedback from the learners that we're supporting, and being able to respond to the needs of the diversity of learners that we have within HPSR, and that it's an opportunity, as Dina said, for us to keep learning as well. So I hope that as we move forward, we can really make sure that the resources that we have and the experience and evidence that we're continuing to build around what works in teaching and learning HPSR is accessible to everyone who can make the best use of it.
Thank you. Francisco?
Hi, thank you. definitely the complexity issue about realizing that whole system it's an entity or social study broader than most people think.
Sorry, Francisco, you may have to type in your response. Francisco, you may have to type in your response.
Of the challenge we have, especially virtual or going online platform, and the difficulties that implies, because
Okay,
sorry,
I think, sorry, your line is breaking. Is it okay for you to type in your response? Then I could read it out. Can you hear me, Francisco? Okay, so these are some of the complexities I suppose he was talking about. Ayat, I'm going to come to you. Can you give us your response, please?
Yes, thank you, and thank you, colleagues. And indeed, as all the panelists have mentioned, that it is complex, I mean, and with the COVID-19, I mean, with the pandemic that we are now living, it just reflects and shows the complexities of the world, of our health system. And it's a reality check for all of us involved in HPSR teaching and learning. Are we building capacities, and are we definitely building the health systems that are resilient enough to cope to the emerging, re-emerging, and now new pandemics that the world is facing. So it is a challenge indeed, but I believe that we're up to this challenge, and us being here, despite all of the complexities and difficulties, is a life testimony to our ability and to thrive, hopefully, and to look at things critically and reassess the way that we are teaching, the way that we are learning, the way that we are responding and reacting to the health systems and to the world that we are currently living in. So I encourage us all to keep on just working and teaching and learning and learning from each other, and every day is a challenge. So yes, thank you. Over.
Okay, thank you very much for that. I'm going to quickly, because of time, allow everybody to give us a take-home message. Please be short in your message so we can remember what you are saying. We'll go around again, starting with you, Lucy.
Gosh, a take-home message. I'm actually going to do something different, Gina, forgive me. Just as a board member of Health System Global, I really want to emphasize how much weight we place on capacity strengthening in all its dimensions. And it is a definite strategic direction for us in the future. And so this conversation is extremely well timed, and thank you for it. Thanks.
Thank you. Okay, so now I can see everybody. Should we go to you, Anthony?
Okay, thank you. I mean, I think one thing I would suggest is that people not be afraid to experiment, to try doing things differently, but to do so with support, with a colleague. So co-teaching, I think, is really valuable. If you've got two people working together, you pick up on different things, you can respond much better, you perhaps add different things to what's happening within the class, and to ensure that you reflect and you encourage students to reflect on what you're doing, so that we learn from experience. I think everyone said that we learn a lot from our students, we do, but also we learn from teaching and develop better ways of doing so, which improve over time. So I think being reflective teachers as well as reflective learners is extremely important, and I encourage everyone to do that.
Okay. Okay, Micah, can we hear from you?
Absolutely. Yes, I would say that, feel free to reach out to us. I think that we're, the TWG is really a wonderful resource. And I know I'm always happy to make time and talk with colleagues. I don't know that we all have, you know, silver bullets, but I think we're all really inquisitive thinkers about these issues, and welcome opportunities to collaborate and problem solve and really hear from you all about what some of the questions and priorities are that you're trying to move forward, and to be able to do that as a team.
Okay, Gina?
Thank you very much. This has been wonderful, and I would like to just say that I'm looking forward to next steps by the thematic group leads and everybody who is here on this session. I am looking forward to the next steps to our continued work. But just my one message, be ambitious. So when you create new programs, think about tacit knowledge starting from community level organizations, researchers, but also talk to policymakers. What is it that's needed? How can you convince them of the value and long-term support and embedding training into practice? Thank you very much.
Okay. Zoe?
For me, I think that we should take every opportunity that we have, even if in difficult situation, there will be opportunities for us to work on, to develop this competency.
Okay. Ayat? Whilst you are commenting, if you can send the results of the last poll, then you can comment on that one too. That would be grateful.
Okay, so thank you. So indeed, our participants, 80% find that the skill building session was useful. That's good. And that they'd like us to engage more in skill building activities in themselves, and are hopefully willing to share resources with us in the group. So we definitely do look forward to that all. And I'd like to thank you all before handing out to Gina. And we're definitely, I mean, we're being challenged, if more now more than ever, not as the TWG, but as a community of HSPR and within the health system, to see how resilient and how well we're equipping our future health system leaders and managers and so forth. And we still have a long way to go. Over.
Thank you. Francisco, can you hear us?
Yes, can you hear me?
Yes, please go
Thank
ahead.
I apologize to everybody, but it was a little ironic. I was speaking about struggles with technology access, and then my connection failed. So I cannot use my video again. But just to give my final message, I would like to stress something about Dina said before, that creating these networks and communicating with each other. Please, we have a really good Google group. That's our main platform of communication. Join us there and use it not only to share information, but also to share questions, to come there and ask for help when you have a struggle, or even when you have success with new approaches, new initiative to resolve the struggle you have. It could be a really nice tool for you. And the address was there. We can share it later again with you. Those who are already members, again, please use it not only to share information, but also to share your questions, your struggles, and ask for help. And that will be my message. Thank you, everybody.
Thank you. So just to summarize everything that has been said, I think some of the key take-home messages for us all is that collaboration and networking is very relevant for HPSR. We must continue to do that across board. We must also make things current, engaging. We should validate people's experiences because people bring a lot on board. We should also be able to learn from each other and also collaborate as educators, as people building capacity, so that we can share our experiences and learn from what others are doing. We don't need to invent the wheel. People are doing so much, so we need to collaborate and form some form of network. There is also issues that has been raised around bridging the divide between institutional learning and informal learning, workplace learning, learning on the job, learning in the field, and learning through practice. All of these have been emphasized so much through our discussions, and I think it is important as people who are promoting HPSR to bear that in mind. Also responding and integrating teaching and learning in terms of what we do. There should be continuity. We shouldn't create barriers to accessing some of these resources that we require. And also we should be ambitious in everything that we do. And I like that very much, being ambitious, being flexible. There are so many opportunities out there. Whatever you are going to teach or learn, it shouldn't be stuck in what somebody has said. Look at your context and explore what is happening. And on that note, I think I must thank everybody who is here, all of our panelists, our speakers, our moderators for a wonderful job. And also everybody who have stayed with us to the end or had left because they have to go. And I'm very grateful for everything that you've done. It's been amazing, very interesting and exciting discussion. And I hope that when we call on you, you come back. And Oliver Twist will ask for more. Thank you very much for everybody. And we managed to be on time, so that is fantastic.
Well
so
done,
bye. Bye, everybody.
Bye.
Okay.
Thank you.
Bye-bye. Thank you.
Thank you.
Thank you very much.
Thank
Bye.
you.
Sure.